Hello friends, today I want to talk about a topic that worries many, but it is not customary to talk about it out loud: urinary incontinence. Yes, the problem is quite common, although many are embarrassed to discuss it. According to the World Health Organization, about 400 million people suffer from various forms of this pathology. Women, especially after childbirth and menopause, and the elderly are most susceptible to incontinence. But this condition can also occur in men, especially after prostate surgery. According to research, about 30% of women between the ages of 30 and 60 have experienced episodes of urinary incontinence at least once in their lives. In the elderly, this figure increases to 50%. Incontinence negatively affects not only a person's physical condition, but also their psychological well-being. People suffering from this problem often experience shyness, anxiety, and depression, avoid social contacts, and reduce their activity. Despite the prevalence of the problem, many patients do not seek medical help out of shame or the belief that this is an inevitable part of aging. However, modern treatment methods can significantly improve urination control and in some cases completely eliminate incontinence. Today we will analyze the main causes of the development of this pathology, treatment methods, the role of exercise, nutrition, folk recipes, and oriental practices in the fight against urinary incontinence. Why does incontinence occur? Urinary incontinence develops for various reasons, among which it is possible to distinguish. Age-related changes. With age, the pelvic floor muscles weaken, and the elasticity of the bladder decreases. This leads to a deterioration in urination control. Hormonal changes. In women after menopause, the level of estrogen decreases, which negatively affects the elasticity of the bladder and urethra tissues. Pregnancy and childbirth. Increased stress on the pelvic organs during pregnancy and stretching of tissues during childbirth can lead to weakening of the pelvic floor muscles. Some women develop pelvic organ prolapse after giving birth, which can also make the situation worse. Illnesses and injuries. Diabetes, stroke, spinal diseases, nervous system injuries, and surgery can disrupt the nervous regulation of the bladder. Overweight. Extra pounds create additional pressure on the bladder, causing it to become hyperactive and provoke frequent urination. Chronic bladder infections. Inflammatory processes weaken the walls of the bladder, reducing their elasticity and ability to retain urine. What triggers the incontinence process? In addition to the main causes, there are factors that can trigger the development of incontinence. Weakness of the pelvic floor muscles. A sedentary lifestyle leads to a decrease in the tone of the muscles that are responsible for controlling urination. Improper nutrition. Excessive consumption of caffeine, alcohol, carbonated drinks, and spicy foods irritates the bladder. Taking certain medications, diuretics, antidepressants, and sedatives can affect urination. Chronic stress. Emotional stress disrupts the nervous regulation of the bladder. How is bladder hyperactivity? An overactive bladder is characterized by the following symptoms: sudden and frequent urge to urinate, even if the bladder is not fully filled. Inability to hold back urine with a strong urge. Frequent urination at night, disrupting sleep. Bladder hyperactivity requires a comprehensive approach, including medication, physical therapy, and lifestyle changes. What exercises will get rid of incontinence? Regular physical exercise helps strengthen the pelvic floor muscles and prevent incontinence. The Kegel method. The essence of the exercise is to alternately tense and relax the muscles that control urination. The exercises should be performed 3 times a day, holding tension for 5 to 10 seconds. Gymnastics, bridge. In the prone position, you need to lift your pelvis up, straining your buttocks and perineal muscles. It strengthens the pelvic muscles and improves blood circulation. Squats and lunges. These exercises strengthen the muscles of the hips, pelvis, and buttocks, contributing to improved control over urination. Breathing exercises. Deep breathing exercises help to relax the muscles and reduce the hyperactivity of the bladder. Why don't Kegel exercises help? The Kegel method does not always produce the expected effect. The reasons may be as follows. Incorrect execution technique. Many people strain the wrong muscles, which reduces the effectiveness of exercise. Neglected muscle condition. If the pelvic floor is too weakened, additional physical therapy may be required. Hypertonia of muscles. Sometimes incontinence is associated with excessive tension rather than muscle weakness. In such cases, Kegel exercises can only make the situation worse. What folk recipes help with incontinence? Traditional medicine offers many remedies that help strengthen the bladder and reduce the frequency of urges. Infusion of sage. Boil 1 tablespoon of sage in 250 milliliters of boiling water. Leave for 30 minutes and drink 1/3 cup 3 times a day. Decoction of dill seeds. Boil 1 teaspoon of seeds in 200 milliliters of boiling water. Let it stand for 2 hours and drink on an empty stomach. Infusion of St. John's wort and golden millet. Mix the herbs in equal proportions. Brew 2 tablespoons of the mixture in 500 milliliters of water. Insist and drink throughout the day. Decoction of blueberries and lingonberries. It has a strengthening effect on the bladder and reduces inflammation. The mummy technique. Dissolve 1 tablet of mummy in water and take it at night. It helps to restore the tone of the bladder muscles. Folk methods can be effective in complex therapy, but you should consult your doctor before using them. Nutrition for incontinence. Diet plays an important role in controlling urination. To reduce the symptoms of incontinence, it is recommended increase your fiber intake. Constipation can worsen incontinence, so it's important to eat more vegetables, fruits, and whole grains. Reduce the consumption of caffeine and alcohol. These substances irritate the bladder and increase the frequency of urges. Drink enough water. Dehydration can lead to concentrated urine, which irritates the bladder. However, you should not drink too much liquid before going to bed. Add foods rich in magnesium to your diet. Magnesium helps relax muscles and reduces bladder cramps. Its sources are bananas, nuts, spinach. Eat foods with a high zinc content. Zinc contributes to the health of the urinary system. It can be found in seafood, pumpkin seeds, and red meat. Avoid spicy and acidic foods. Foods with a high acid content, such as citrus fruits, tomatoes, vinegar, can irritate the bladder. Following these recommendations will help reduce unpleasant symptoms and improve urination control. What is the secret of incontinence that the Chinese know? Chinese medicine has centuries of experience in the treatment of urinary incontinence. Chinese techniques are based on an integrated approach, including acupuncture, herbal medicine, qigong, and diet therapy. Acupuncture and acupressure. Acupuncture stimulates bioactive points responsible for the functioning of the bladder and kidneys. In Chinese medicine, incontinence is often associated with a lack of qi energy in the kidneys and spleen. How to use light massage of the indicated points in a circular motion for 3 to 5 minutes in the morning and evening. Acupuncture is performed by a specialist in courses of 10 to 15 procedures. Phytotherapy. Chinese medicine recommends decoctions and infusions of medicinal herbs. Psyllium seeds. Pour 1 teaspoon of seeds with a glass of boiling water, leave for 20 minutes, drink 2 times a day. Astragalus root. Boil 1 tablespoon of the root in 300 milliliters of water for 10 minutes, drink before meals. Polychrome mountaineer. 2 teaspoons of herbs per 500 milliliters of water, boil for 15 minutes, drink 3 times a day. Qigong. Special exercises help to restore the tone of the pelvic floor muscles. Lifting the sky. Stand up straight, raise your arms above your head, stretch upward, straining your pelvic muscles, and hold for 10 seconds. Repeat 10 times. Pelvic compression. In the prone position, tighten and relax the pelvic floor muscles for 5 seconds, 15 repetitions. Diet therapy. Red rice, 100 grams per day. Ginseng root tea. Pour 200 milliliters of hot water into 1 teaspoon and leave for 10 minutes. A decoction of mandarin peel. Pour the dry peel with water, 200 milliliters, boil for 5 minutes, drink warm. Urinary incontinence is a serious but treatable problem. The main thing is to start working on strengthening the pelvic floor muscles in a timely manner. Adjust nutrition and use effective treatment methods. If the symptoms worsen, it is important to consult a doctor who will choose the optimal course of therapy. Modern methods allow not only to control the problem, but also to completely get rid of it.